Guys, okay, so I'm redoing the video where I am showing you guys the mnemonics for hyper, hypo, emia with the sodium, the sugar, and I've added fluid volume. So this is what hypo means, this is what hyper means, and this is what emia means, okay? And then you'll see the rest on the whiteboard. No worries if this video seems like you're having deja vu. It is because I have made a video just like this. This is take 2. So hypo, I want to teach you guys, hypo means low in medical terms. So anything that's out of range but on the low end is called hypo, low. Anything that is above normal range is called hyper, high. So think hyper, higher. And emia means in blood. So whenever you see emia at the end of a word, it means that it is in the blood. Okay, so let's start with glycemia. That is the glucose in your blood. Hypoglycemia. Mnemonic, cold and clammy, need some candy. So you're going to feel cold and clammy and yeah, your sugar's low. So hyperglycemia is hot and dry, sugar high. So there you go. Now, so that was sugar. Let's go to salt. So natremia is sodium in the blood, sodium, salt, Na. Hyponatremia, think salt loss, okay? So I want you to think of that word, salt, well, 2 words, salt loss. S is for stupor, A is for anorexia, L is for lethargy. T, tendon reflexes down, think salt down. L, limp muscles, think down, salt down. O, orthostatic hypotension, which means that your blood pressure can drop if you stand up suddenly, as can you. If your blood pressure drops, you can go down. So be very careful. S is stands for seizures. The other S, stomach pain. Okay. Now let's move over to hypernatremia, high salt. So you're going to have S for skin flushed, A for agitated, L, low grade fever, and T for thirst. Okay. So salt and then salt loss. So hypovolemia. Volemia is volume. Think fluid volume. Volume, how much volume you have. So hypervolemia is high fluid volume and hypo is low fluid volume. So fluid overload, dehydration. Okay? So hypovolemia, which means you are low on fluid, you are dehydrated. Think chart. Concentrated urine, these are the signs and symptoms, by the way. Concentrated urine, H, hypotension, remember that's the low blood pressure. A is for anxiety because it messes with your neurological system. R is for rapid rate and respirations, rate meaning pulse. And T, temperature increase. Okay, now let's move over to hypervolemia, which is fluid overload. You have too much fluid. Think of swell. S is for swelling, W for weight gain, also known as edema. E is for elevated blood pressure. L is labored breathing. You can have fluid on the lungs. And then L is for leg pain. So sometimes where we tend to collect fluid is the ankles, the legs, the face, and hands. And if your ankles and legs are swollen, they can be achy and painful. So I hope you learned something. This is my little hypo information. Let me know. Bye.